My name is Ashley Kizzy, and my program is on wheelchair transfer safety for a spinal cord injury patient, specifically those that have paraplegia. So, what is a spinal cord injury and what is paraplegia? A spinal cord injury is any type of insult to the spinal cord, resulting in either a complete or incomplete injury. A complete spinal cord injury means that there's absent motor control um, and sensory function below the level of the lesion. An incomplete spinal cord injury is that of partial or complete function that is preserved. The most common cause of trauma, um, the most common source of spinal cord injury is that resultant from trauma, and that can be due to either a motor vehicle accident, a gunshot, or a stab wound, falls, or even sporting accidents. There are other causes of normal spinal cord function. There are other causes of interruption, and those are the bulleted ones there, such as tumors, MS, ALS, cancer. I won't read all of them, but they are listed there. Paraplegia is a specific effect of spinal cord injury, and it's paralysis of the lower extremities with involvement of the trunk and hips, depending on the level of the lesion. So, how is paraplegia diagnosed? So, there is a scale known as the American Spinal Injury Association Impairment Scale, or the ASIA scale, which determines the level of the lesion, whether or not the spinal cord injury is complete or incomplete. It also determines the area of the body where sensation um, is either intact, impaired, or absent. And just for further reference, OTs would not diagnose. It would have to be from a physician or a spinal cord injury specialist. So, how is spinal cord injury or paraplegia treated? Of course, there's surgical treatment and intensive medical treatment that can be provided. Medications could be given to a client with this type of injury for pain and other medical complications. Occupational therapists and physical therapists will provide treatment, but according to our Pedretti textbook, there's no amount of rehabilitation that will affect the degree of recovery. So, when looking at the prognosis of spinal cord injury, as mentioned in the previous slide, there's no amount of rehabilitation that's provided by either an occupational therapist or physical therapist that will um, increase the rate of recovery. So, the whole goal of occupational therapy is to preserve and even optimize the amount of function that a client does have um, given their medical situation. The prognosis of spinal cord injury depends on these bulleted factors, whether it's complete or incomplete. If there's no sensation or return of motor function below the level of the lesion within 24 to 48 hours, it's said that motor function is less likely to return. Partial to full return of function to one spinal nerve root below the fracture can be gained within the first 6 months. And typically, the longer it takes for a return of motor function, the less likely it is that function will return. And these are just certain guidelines that health professionals go by because it's not guaranteed when function is going to come back, how much function is going to come back, but these are just a few guidelines that are followed. So, what can occupational therapy do for a spinal cord injury patient? Um, an occupational therapist can prevent further medical complications through education, whether that be to the client and to the family or caretakers, to maintain and improve strength and skills that are present, maximize function and self care activities, facilitate mobility, optimize lifestyle options for both the patient and the family, and just maintain the overall quality of life of that patient. So, what are the complications of spinal cord injury? So, these are the main complications of spinal cord injury that was laid out beautifully in our Pedretti book. So, for the first one, pressure ulcers and skin breakdown is a big factor from being immobilized because of the spinal cord injury, decreased vital capacity, which affects activity tolerance, osteoporosis, hypotension, autonomic dysreflexia, spasticity, and even heterotopic ossifications. These are certain complications that, as OTs, we must understand and be aware of their severity as it relates to function. So, these are the functional performance issues that an occupational therapist can assess and treat when dealing with a spinal cord injury patient. The main one that we will talk about in this presentation and according to the handout that I created will be on transfers and transfer safety. So, when looking at transfers for a spinal cord injury patient, as an occupational therapist, we must understand that um, means of mobility will be most likely from a wheelchair or some type of power chair device due to their inability to ambulate independently and function within their environment. It's important that an occupational therapist not only um, educate a patient on transfer safety, but also educating them about efficient transferring, because it is an ADL that they will partake in daily. So these are the listed bullets of reasons to why they may have issues. So now we're going to go into the actual steps of transfer safety from a wheelchair. So the first step is to first recognize as a patient if you need help transferring. So this could depend on, do you have enough trunk support? Do you have enough upper extremity strength to do this? And if you do need help, obtain the help and make sure you have the proper equipment set up. So equipment would mean um, either a gait belt and or a sliding board, which would facilitate the transferring motion. So the second step would be to position the chair close to you at an angle. So you want to make sure that wheelchair is close to that transferring surface that you're going to or either from, and make sure that it's at an angle with the brakes locked. So now the next step would be to remove or swing back the armrest that is actually in the direction of the transfer. So you want to make sure that armrest is out of the way. So depending on the type of wheelchair you have, you can either completely remove it or swing it back so it's not in the way. So if you're able to complete this transfer on your own, um, and you're using a sliding board, you want to make sure that you're placing one end of that sliding board under your ischial tuberosity, which is the technical name for your bottom, and make sure it's at an angle and it's going in the direction of the transfer, and make sure the other end is on the transfer surface. So you want to make sure both of your feet are under your hips as you scoot onto the board. And as you're scooting onto the board, you want to make sure you're leaning forward and you're using your hands properly to scoot um, slowly onto the next transferring surface. You want to make sure your movement is slow and controlled. And you want to make sure that you don't pinch your fingers under the board, and you want to make sure you don't put your hand in the hole of the sliding board, for this can cause injury. Once you've completely scooted all the way into your wheelchair or even onto the next surface, you can readjust your armrest back into its irregular position, and then you're ready to become mobile within your environment. So, if you have someone helping you with this transfer, be sure to have them use a gait belt, because when this gait belt is around your waist, this is your main point of control. So just in case you get off balance or you're about to fall, they can have a better grip on you. And be sure to communicate with one another to ensure safety and efficiency during this transfer. And as a helper, they should always use proper body mechanics, not only for their safety, but for yours too. So making sure your base of support is wide and you're bending your knees and not using your back. So these are three really good additional sources that discusses transfer safety for a spinal cord injury patient. Um, it's a combination of PDFs and websites that lead you directly to even other sources and other handouts and PDFs that someone could refer to and print off easily.